We have to find real solutions, and this is Bending the Trend. Hello, and welcome back to Bending the Trend with your host, Norm Volsky. And today we are thrilled to have the founder of community-owned health plans, Niko Caparisos.
Got it.
How are you?
Glad to be here.
What's going on?
I'm doing good, buddy. How are you?
I'm good. We're just, fighting the good fight, fighting for employers and employees to spend less money on their healthcare. So excited to have you. And, you've built an amazing organization, down in the Southeast, and would love to, just ask, what's working? You've got, a bunch of employees, all kind of grouped up into a health plan. You've created some great efficiencies. You're driving some really nice cost savings. You're a fiduciary consultant validated by the Validation Institute. So tell us, which vendors have you worked with at community-owned health plans that have done really well and have helped you, save your clients money on their healthcare spend?
Yeah. So again, happy to be here. More than glad to elaborate on the vendors that really shine. As a GA and someone who created a health plan, I was always looking to solve for broker level challenges, right? Alongside group level population health, right? Streamlined, easy to do business with, kind of areas as well. So, the vendors that I've really liked in the past couple of years, especially because it's always kind of a moving target, right? We know this industry is in flux all the time. Covet Health and Angle Health, both self-funded, level-funded, health plan offerings within their product portfolio. Angle's a little more turnkey. Covet's a little more customizable. They do traditional stuff as well. And then CapRx and MakeRx, right? So two PBMs that just really have shown to be very proficient, right?
It's awesome.
Those are the vendors as of late that have really kind of stood out and struck out to me, and for some reasons I'll elaborate on. Next question.
Awesome. So talk to me about what the results are of implementing those solutions and how it's been beneficial for you as well as your members.
Yeah, so there's a couple of year period there for, I think, a lot of brokers, consultants, plan builders, right, where it's like point solution madness, right, and it's so confusing. And for things to operate well and quietly, at least what I have found is that it makes a lot of sense for things to be structurally set up a certain way and to embed vendors that are going to basically execute on the various things needed to actually control costs, right? Totally. So that's been huge, right? So like setting up the PBMs and making sure that they can fulfill their promises, because everybody has a nice slick and marketing message, right? But to actually know that they are engaging members, right? Mm-hmm. And then same thing on the health plan side, right? Like ease of business, capability, robustness. If they're responsive, if they're very innovative and they're walking alongside you in some of these things that are outside the box in terms of strategy, but also quiet, right? Quiet on the TPA and health plan side, quiet on the pharmacy side, because it doesn't sound very exciting. But if you've spent a lot of time structuring something a certain way so as to then save claims, the last thing you want is a ton of noise. Yep. And like these four vendors in particular, yes, issues arise in healthcare and claims and just in general, like it's a complex field. But for the most part, and by and large, right, when there are issues, they're easy to solve for. And then there are less frequent issues relative to other vendors that I've worked with in the past. So, Yep. 2 thumbs up for those.
I'm pretty sure the BUCAs also have those issues.
I think so. And the problem is like it's less apparent, right? When things go wrong, it's more like people are overcharged and providers are clawed into with their reimbursements. And that's a huge issue, right? But no one notices because the norm, of course, is, hey, this is just how healthcare is. But then when you have like a bundled surgery and something doesn't go right, and then you've got to investigate and unpack things, at least it was an error that you could actually solve for cost-wise. And they were doing the right thing on the front end, as opposed to with, again, the BUCA contingent, people are just overcharged for services and providers are just paid less than they should be most of the times. And no one notices those issues because it's just so legacy and it's so entrenched in our mindset. So the issues when they arise are testament to the fact that we're actually controlling costs and things are actually trying to connect. And then sometimes it takes a little bit more, to put the pieces together.
Totally. At Bending the Trend, we are really trying to educate people that there are cost savings to be had by trying new things. Can you walk us through just like high level where creating a new PBM structure and creating a new health plan structure has driven cost savings? Like,
yeah,
what
100%.
are you seeing in the data on the savings side?
Yeah, absolutely. So a lot of it involves a dialogue, right? And also in knowing where planned spend areas are, right? So like PBMs, low hanging fruit, right? Like a lot of Americans are prescribed medicines, right? A lot of them are costly. It's maybe 20 to 30% of planned spend, right? Just generally speaking. So in approaching, PBM relationship, you want to make sure that, the TPA understands that model. You want to make sure that the underwriters properly decrement and discount for having vendors involved. So a lot of what I did preemptively and like laying the groundwork for the plan, in terms of the foundation, was to make sure that everybody was on the same page, right? It took a lot of conversations. It's like, hey, look, I'm not just going to bring in any PBM that has a shiny message, right? Or something appealing, but it's new and it's untested, right? I was able to actually produce discounts with my product in underwriting by having said dialogues and by being
Yes.
open and by being flexible, right? Because I had a choice to choose any PBM, right?
Yeah.
But when the message back was it's going to produce a higher premium and you're going to have, at least I circled this together in my mind, right? I'm
Mhm.
going to have a harder time selling something, right? And so if the underwriter believes there's cost savings associated with a vendor, that's a pretty strong message and something you can take to the bank because it's their money and their risk on the line. And like, let's be frank, like we're not underwriters. A lot of people are not. A lot of people don't have that level of skin in the game. And so that's where the rubber met the road for me, is like having these dialogues, making sure things are set up properly on the front end, and then triaging issues as we have to.
Do you have like a percentage cost savings from switching to that PBM or switching to that
You
alternative
know, I
model?
wish I did. I wish I did. I'm less organized to that degree, right? Now that I have standardized a block of business and I do have analytics, I could, identify and showcase, trends over time. It's most of the time what I see as a result, Norm, is like I will see, massive pharmacy rebate checks going directly to the client, right? Or hey, bundled surgery actually did happen and here's what it saved the plan, right? Or just a postmortem, of those sorts, right? Where I'm getting this information after the fact, or maybe it's something is prior authorized and then it's sourced at a lower unit cost, and then I know that there's savings that are being generated there. So again, a lot of it's so structural because we don't have time to be involved in all these claims all the time. We just have to really, make sure it's set up to be turnkey, smooth, and cost effective at the same time.
Yeah. And because you created your own health plan, like member experience is like very important to you. We've discussed it, when
Right.
we've gotten together over the last handful of months. Walk us through what you wish existed from a technology and services standpoint that doesn't yet. Maybe it inspires an entrepreneur to start something
Yeah.
new and solve
Yeah.
the issue that like people in your seat feel need solved.
Yeah, and it's a little bit of a loaded question, which makes me appreciate it, right? Because I know I might get messages afterwards. But that said, in all seriousness, it's education I've really struggled with, and it's not for reasons that are necessarily solvable, outright. Because like there's a ton of great websites, right? And there's like mobile apps out the wazoo, and like everybody has a service team, right? But when you're building something complex, like it really has to be the education is part and parcel with using the plan, right? And so that's something that not necessarily it doesn't necessarily exist right now, right? Where like you could put in a concierge, right? Or you can build a website, you can have a mobile app, requisition for your setup and your stack, right? The thing that I've struggled with is high build times, right? It's really an investment of time. When you have so many irons in the fire, it's really hard to devote and say, hey, I'm going to build you a website, and like, will your people use it? Yes or no? That's why I wish that there was a way to have everything integrated with as people use the plan, right? To have this advocacy kind of embedded into the process, whether it's medical or pharmacy benefits, or surgery, or choosing a direct primary care doctor, right? Because there's solutions that kind of fit all of these areas in a fragmented way. And it's not easy to envision what the solution is, right? Because again, there are these various different means and modes of communication. But the problem is the time investment, the replicability, integrations, making sure those could and will happen when you have especially like 8 different vendors, right? Is it going to be functional? So I wish that was something that could be more easily addressed, but I wish I had also the answer as to what that could look like, right? Because maybe it's on the ID card or something crazy where it's like a QR code, right? I
Huh?
mean, there's all kinds of ways to solve for it. And it's not like I'm reinventing the wheel here, but people forget about anything educationally speaking, like after open enrollment, right? Or they
Totally.
think about their health plan only when they have a problem or when they can't get a script filled, right? And we know that's an underlying issue. So even a slick app that's great, it's like people aren't going to think to use it unless there's a problem.
Correct.
So it's kind of a circular problem and argument, I guess I'm building, but at the same time, like I think there's a huge opportunity there because there's a ton of bespoke plans, right? And there's no one easy way to communicate all the benefits when you need to. And I think the last bit is the operative when you need to, right?
Yep. Well, I'm constantly looking at new tech and what's coming out, and I think things will be coming soon, that will get you pretty excited. So
I imagine.
Fingers crossed. Execution is key in these things. And again, thank you for joining us on Bending the Trend. Keep saving your members and employer customers, some significant dollars, which you have an amazing track record of doing. And keep passing along those savings to them as a fiduciary. So thank you, Niko, for being here, building what you have, and keep doing the good work. Appreciate it.
Awesome. You too, my friend.
Thanks for watching Bending the Trend, where we are looking to fight rising healthcare costs. We are asking benefits leaders what digital health solutions they've implemented that has helped them bend the trend.